Back on MorningLine, thanks for joining us on this Tuesday. We're talking with Lisa Milam, forensic social worker with Our Kids. What is a forensic social worker, Lisa?
Well, I'm a social worker. Essentially, forensic just means that everything we do has some sort of legal implication, because what we're doing is dealing with, well, it's a crime, but it also, children who come in have health needs, but those things that have created their risk to their health are also things that are involve possible criminal activity. So those situations have to be managed in a certain way.
As someone in your position, do you take note of these high-profile cases when children disappear, like the one with the Summer Wells case?
Certainly.
What goes through your mind when you see cases like that?
Well, I mean, there are a lot of things, and certainly the TBI agent alluded to the reality that you have to consider all possibilities. I think anytime a young child goes missing, the initial focus has to be on, what happened in those early moments, who was last with the child. Certainly children are abducted, and at the same time, there are answers to some questions about, the moments before a child goes missing. Someone has to have known where that child was, what was going on, just in that immediate environment. And I'm certain that law enforcement is focusing on those kinds of things. But we're aware anytime we see an Amber Alert or something involving a child, we're certainly aware of the possibility that child may be a victim of a sexual assault that will then, be presenting at a healthcare facility, once they're identified or found and recovered.
The longer it takes, the more time that passes, the more difficult you think for any of these types of things to be, dealt with?
Oh, there's no question.
Yeah.
No question that the longer it goes, the more concerning it becomes and the more difficult it is for law enforcement.
Sure. Just as far as, again, for the general public, and I think the special agent touched on some of it, I just wonder, I think back to things maybe where I've seen things that were odd and maybe I didn't think enough about it. What kind of stuff? What would really get you if you're walking through the grocery store and you observe something to, hey, whoa. And I'm not talking about something blatant, but what kind of thing for you, and you're a cut above me in terms of recognizing these things, but would get you to say, oh, wait a second, I'm not going to let that pass? What would hit you?
Well, I think, and the agent mentioned that idea of something that just doesn't feel right, that seems out of place. But to drill down a little bit deeper, particularly with teenagers who are not accompanied in certain settings, whether that's travel, like bus or airline, something like that, who are unaccompanied, that's going to raise an eyebrow. Teenagers that have no apparent means of support or income, and yet their hair's done, their nails are done, they're dressed to look more adult than they are teenager, and that's a pretty gray area with anybody. But there are some things about that would get your attention. Certainly, teenagers in hotels that are not accompanied, or where there are multiple individuals coming and going, or the same teenager coming and going to that hotel. In healthcare facilities, teenagers that have repeated positive testing for sexually transmitted infections should be a pretty significant red flag in a healthcare facility.
Sure.
Anyone who brings a child into a healthcare facility and doesn't have a good history on that child, for example, it's one thing to bring someone in and say, hey, this just happened. But when a healthcare provider is asking questions about past medical history, and that adult doesn't know the answers about where that child was born, or things about the birth weight, or things about the child's immunizations, other healthcare information that parents typically know about that child, that's going to be a red flag that adult is not the parental figure for that child. So those are the kinds of things that you're going to be looking for. For most sexual abuse, what a child tells you, a child's report that something is going on is the number one indicator for sexual abuse. when it comes to trafficking, that's difficult because teenagers will often provide inaccurate information. So when you have a teenager who is giving you information that simply cannot be true, and again, examples of that, I mean, I've had children tell me, that, they live in, say, California, but they've been here for a week. Well, how did you get here? And I can't get an answer. I get a different answer every time that question is asked. Who is it that you've been staying with? And they can't tell me the address or the name of the caretaker. Those are the kinds of things that are going to quickly raise our concern that this may be a human trafficking situation.
Yeah, I mean, those are good, all examples. And I guess in all cases you would say, well, try to contact law enforcement. I'm saying you're caught in that moment there. So what kind of action can you take? I mean, I just can't see myself saying, okay, great, now I'm gonna go make the phone call and it's gonna be 20 minutes before the cops get there and by then they're gonna be gone. I mean, I would be inclined to take action.
Well, and I think it's important, and again, I listened while the agent also commented on this, you want to be careful that it's not, and there are exceptions to every situation, but it's not the job of a bystander to intervene or to investigate. And again, there are exceptions to every rule, but generally you want to do things, make the phone call, but maybe look for, is there a vehicle that's associated with that child? Get the tag number of that vehicle. Make sure you have a description, look at who's with that child so that you can provide a description of the people involved, either what someone was wearing, any particular identifying marks. Just be more aware when you're seeing something as what are you seeing so that you can provide accurate information to law enforcement. Even something as simple as which direction did that person or those people leave? Did they walk this way? Did they drive that way? Again, the vehicle description, those kinds of things.
How about following them?
Again, there are exceptions to every rule. I think that people have to use their best judgment, right. But recognize that when bystanders begin to do those kinds of things, they also create a high risk for that child of significant danger. And so,
you would have to be stealthy about it, and they wouldn't need to know that you're following them.
Yeah, and I think that's the thing that when you begin to think about doing those things, it's probably crossing a line of what you want to involve yourself in.
Okay, well, I had to ask that question because I guarantee you people are thinking that. And I guess in each case you judge it. But I can tell you this, if I perceive a child being in physical harm at that moment, I'm intervening. End of story. I'm not waiting for someone.
Yeah, and again, I think that's a judgment call that everyone has to make. If you think there's a danger, obviously you're calling 911.
Right, right.
And using your best judgment.
As far as adults just approaching, the last question here, it's a delicate thing. Any adult approaching a child that maybe has been sexually abused and how to talk to them or deal with it. Any tips on that front if you observe that and how you go about asking those questions?
Yeah, it depends on the age of the child.
Okay.
I mean, with children, you can simply ask the question, is there something going on, that's uncomfortable or something sexual that doesn't feel right to you? For younger children, it may be as simple as asking, is there something going on that's bothering you? I think the most important thing that parents and family members and people close to kids can do is let kids know it's always okay to tell if someone's touching you on your, private parts or doing things that feel uncomfortable. It's okay to tell someone, to find a trusted adult and tell them. And then, checking in with your kids about what's going on in their world and what's going on in their lives. One of the protective features for kids of all ages is connections to whether it's family members or people close to the family. But being connected to lots of people, that's a very protective feature for most kids. Kids who are isolated are far more vulnerable.
Gotcha. Just as we wrap things up here, it would be nice if we no longer needed our kids. Not that I don't like what you do, of course, you know what I mean by that. But the bottom line is I think you guys are as busy as ever, huh?
We certainly are. Our numbers are, remain pretty consistent, and we provide, this service, medical care for victims or alleged victims of sexual assault for 47 counties in Middle Tennessee. We see somewhere between 800 and 900 kids a year, and that number has not slowed down.
Yeah, well, you guys are deadly serious about what you do, and you're all very, very good with it. And hopefully you get back up and running now that we're at this pandemic. Let's do Soup Sunday again and raise a lot of money and have some of the fun runs. And tell to Sue that I'm ready to go on any of that whenever you need any help on any of those fronts, all right?
We will, and we appreciate all the support.
Yeah, you bet. Lisa, thank you. I appreciate you coming on this morning. Have a good day, all right?
All right, thank you. You too.
Thank you so much. Listen, we'll take a break. She's great. We'll take a break, wrap things up with a programming note right after this. Stay with us.